My name is Judy Halili. I'm 40 years old. I work in labor and delivery here at UT Southwestern for the last 11 years.
My name is Dr. Ellen Wilson. I am one of the reproductive endocrinologists here at UT Southwestern in the Department of OBGYN and the Division of Reproductive Endocrinology. Judy was diagnosed with a mass in her pelvis when she came to see me, and what we determined on MRI that it was a fibroid tumor. Now, fibroids are the most common tumors that women will get involving their uterus. They're 99% benign, but they can cause trouble.
I was having severe abdominal pain whenever I get my period, and so and actually the urinary frequency, I thought it was just normal for me, probably having a small bladder. But when they got the fibroid out, they found out it was between my cervix and bladder, so that was what was causing the urinary frequency.
If a woman has a fibroid or several and she wishes to still become pregnant, maintain her fertility, then we do what's called a myomectomy, which is just leaving the uterus in place but taking out the fibroids themselves instead of doing, for example, a hysterectomy that would remove the entire uterus.
Dr. Wilson and the other doctors that worked with her, they did comprehensive history assessment and, of course, recommended the right procedure, the robotic surgery.
One of the things we did when I first saw Judy was to order some tests. I wanted to know what this pelvic mass was. I got an MRI, which determined that she had, in fact, fibroid tumors. Secondly, we were looking at any blood work that would indicate any sort of problems that we may want to know about before surgery. And then we approached the surgery again, in her case, with a robot, which I think was a way to do her surgery. If she hadn't had her surgery done with the robot, it would have been a very large incision for her, which would have been multiple weeks off of work and a much more painful recovery for her. With the robot, we were able to use very small incisions where she was able to go home the same day, have a very little blood loss from the procedure, and she recovered very quickly from this.
I feel great, very great, and have been happy that I had the surgery, especially the robotic surgery, because true to what it said, less scarring, less pain, faster recovery, so I'm back to work.
Judy is doing great. She is back to work already and is feeling very, very good. She healed beautifully.